All right, I've got Dr. Toli here from Mila Family Health. He just opened a direct primary care practice right across the street from me. So I wanted to bring him in. You guys know that I think direct primary care and cost plus pharmacy work perfect together. So I'm going to ask him some questions and learn what made him want to get into direct primary care. All right, Dr. Toli, what made you want to go independent?
So I'd always been interested in starting my own type of practice, kind of breaking away from the big hospital system, big residency system, and just building my own practice for my patients.
Now, when you went independent, what made you choose to go with direct primary care versus like a standard accepting insurance, that type of setup?
So I chose direct primary care instead of an insurance-based practice because I already spent some time in a residency working in an insurance-based system. And because insurance is the payer of healthcare in those systems, they're the customer, patients, what patients need, like it doesn't really matter to those systems, honestly. And so what insurance-based practices make you do is see patients in 5 to 10 minute intervals, like 10 to 15 patients in a half day, 20 to 30 patients in a day. Doesn't let you call, text, email patients, even if things could easily be resolved over the phone or via text message. Because insurance doesn't pay for healthcare that way, you can't see patients that way. So it's not really patient-centered care. So I just couldn't see myself doing that.
Interesting. Yeah. That's one of the things that I've really learned a lot about since we opened this cost plus pharmacy. I've dug into the way the insurance works, and it's just become so clear to me that they are the customer.
Definitely.
And so then the prescriber, the physician is dealing with the insurance as the primary objective, not the patient.
Exactly.
Yeah. Now, another thing that's interesting about your place is that you do membership rather than doing the pay per visit. What is your reasoning for choosing that?
So a membership-based primary care clinic is kind of the more traditional way to do a direct primary care practice. The reason for that is so patients pay a low monthly membership for access to care, access to same or next day visits, longer appointments, ability to call, text, email the doctor. All that's included in the membership. It just makes it easier for the physician and for the patient so that every time a patient texts me, I don't have to worry about billing that patient for that encounter. I just know that that's included in the monthly membership. And patients don't have to worry about sending a message and it not being covered or do they have enough funds to cover this visit or not. It just simplifies everything for the doctor and for the patient.
Yeah, awesome. All right, and then last, going out on your own, that's scary. What about all your coworkers, your family? What kind of feedback did they give you when you told them that you were going to be going out on your own?
I think the most important bit of feedback was my wife's support for me to go out on my own. I think if I didn't have that, then I wouldn't have been able to do it. And then I think overall people were kind of hesitant, like, why are you doing this? What's making you want to do this? That type of thing. But overall, I kind of had a strong feeling that I just needed to do it. I wouldn't have survived in an insurance-based practice that's not patient-centered. So there's a lot of support in the direct primary care community. So other clinics, we all support each other. Cost plus pharmacies, we support each other, and we just help each other out basically, and support each other and make it work.
Nice.
Yeah.
All right. So go to Mila Family Health. What's the website?
MilaFamilyHealth.com.
Awesome. And he's right a catty corner from us. We're 2410 Forest Park. What's yours?
2501 Forest Park.
Awesome. So check it out and give it a look.
Thank you. Appreciate it.